Hi, I'm Dr. Sri Nagesh, a plastic surgeon at Omega Hospitals, Hyderabad. If a child was born with a cleft lip or palate, that's when the lip or roof of the mouth doesn't completely form before birth. Let me walk you through what lies ahead. A cleft happens when certain parts of a baby's face do not join together properly during early pregnancy. Think of it like a jigsaw puzzle that needs to be put in place. Some babies have a cleft lip while some have a cleft palate too, that is the roof of the mouth, and some have both. A relief for parents is that we know exactly how to fix this. Thousands of children go through cleft repair successfully every year and they grow up to live a complete normal healthy life. Here's how the timing usually works. A cleft lip repair usually happens when your baby is around 3 to 6 months old. By then they are big enough and strong enough for surgery but still young enough to heal beautifully. The cleft palate repair usually comes between 6 to 18 months. We wait a bit longer because the roof of the mouth needs more time to develop. Recovery is usually smoother than most parents expect. Your little one might be fussy for a few days, but the children bounce back remarkably fast. You need to be a little extra gentle with feeding and keep the surgical area clean, but most babies adapt quickly to the new normal. Your child will have an entire team cheering them on: plastic surgeons, speech therapists, orthodontists, and sometimes ear specialists too. Everyone works together to make sure your child can eat, speak, and smile with confidence. A child's cleft can be beautifully repaired with the right team and proper timing. They will have every opportunity to live, laugh, and smile like any other child.